Even though the U.S. has great healthcare, not everybody has access to it. This just allows people access to that same great healthcare at a lower cost at a different destination. We're using joint commission facilities that are very high quality. The surgeons that we chose for these facilities actually operated on their president. So we're using the best surgeons in their country.
Hi, everyone. My name is Kumar Dharmarajan. I am the Chief Medical Officer for World Class Health. Very excited today to be joined by Tim Isenhower, who is an HR veteran for more than 30 years. And importantly for today's conversation, has, I think, more experience with his employees accessing healthcare internationally at global centers of excellence than anyone I know, and can give us some insights into the employer perspective around global centers of excellence, as well as employee perspective and what they have to gain from the model. Tim, it's great to have you today.
Thank you, Kumar. It's great to be here.
So, Tim, why don't you just start by giving us a little perspective on your experiences with destination healthcare?
Sure. So I come from a manufacturing company here in the Southeast. We were located in 16 states across the country. So we had all kinds of U.S. applications throughout the states. Trying to manage a self-insured health plan, very difficult back in the 90s. Healthcare costs had double-digit inflation to where the only options were available were PPOs, HMOs, which didn't seem to work. Around 2007, after we had dealt with all the inflation for medical for so many years, I was at a conference actually where a local facilitator who actually helped folks who had no insurance whatsoever to travel to India for procedures they couldn't afford here in the U.S. As I saw this speaker speak at this HR conference, I was just enlightened by what he was saying, while most of the group was in horror because this group was sending people to India for surgeries, which they just thought was odd. So I slipped this guy my card and said, "Give me a call. I'm interested. If you can do it for individuals, we're a self-insured employer. I don't know why it wouldn't work for us." Because what I see in the procedures that this guy was talking about in India, just super high quality care at facilities that actually were affiliated with Harvard at the time. But that's how we learned about the program. After that, we took that to our CEO, who happened to be on our local hospital board here in Hickory, North Carolina, where I'm from. And of course, he said, "I've heard of it. Uh, it has been around. I don't mind us looking at it. Go to India, check it out, and see what you find out." And that's what I did. So I went to India, went to a hospital called Fortis in Bangalore, a very specialized hospital for orthopedics. They also do gastric bypasses, neurosurgery, and all types of care there. So I had a physical there that was just phenomenal. I mean, you talk about um, the processes they have are so fine tuned that I was able to have all these tests and procedures done within a several hour period and have all my results before I left. I was amazed. I was very impressed. So I went back to our CEO who, I said, "Okay, let's try it, but let's not tell anybody. Let's see what happens." So that's when we rolled it out to our employees in 2007. Uh, Going out to our locations for open enrollment for our benefit programs, we started to roll out the uh, medical travel piece, and people were intrigued, and some were even horrified actually at the thought of flying to India to have a procedure. But when we got back to our hometown here in North Carolina, one of the last meetings we had a forklift driver. He raised his hand, waving it so enthusiastically, saying, "I'm going, I'm going. I've got to have a knee replacement. My doctor wants $3,000 before he'll even set me up for procedures." So he was our first patient. And lo and behold, even though the guy told me he was a well-tuned traveler and had people that could go with him to help him, we later found out that no, he wasn't a well traveler. He'd never flown on an airplane before. In fact, he did not even have a companion to go with him. So little did we know the fellow put an ad in the paper to have a companion go with him, who someone accepted. And once we heard this, I realized, oh my gosh, this may not go well. So I went with the fellow over to India, and it was very comical actually, just because, this is a person who's never traveled, and here he trusted us to go to India for this knee replacement. He to the point where, uh, his inability or inadequacy in traveling, we were flying over to India. He says, "I don't understand why it takes 20 hours to get there and 5 hours to get back." And I said, "Well, it's a time change, Bob." And he didn't know anything about a time change. And then a little bit later, he spoke to me saying, "Tell me when the time changes. I want to see what it looks like." So that's the kind of person that was our first patient. So you can imagine how we felt this may go. But lo and behold, the guy got back. He had his knee replacement. He went back to work in a very short period of time after that knee replacement and told everybody how great the experience was and how well he was doing. Once he did that, the program just exploded. Lots of folks interested in going over to India at the time to have procedures done there.
That's that's some first story about the first patient and the experience of that gentleman. So that's, your early experience with India. I know over time, some of these procedures have gone to other countries, Latin America, maybe the Caribbean. Can you give me a sense over time, how many patients have you seen travel as part of your company to receive procedures overseas? And can you give me a sense of their experience? Who are these people? Why did they go? And what was the medical experience like?
Sure. So as you said, we did expand the program into Latin America. We had a Hispanic population that was not taking advantage of the India option. So we opened up a facility in Costa Rica. And again, we're using joint commission facilities that are very high quality facilities that offer high quality surgeries. The surgeons that we chose for these facilities, at these facilities, actually operated on their president. So we're using the best surgeons in their country. We have a lot of facilities that are rural in our company, places like Tupelo, Mississippi, Hickory, North Carolina, even though we had places in Los Angeles, California, and Portland, Oregon as well. We did have the rural sectors as well. So we didn't think they would accept it very well, but they did. India was just such a far place to go, and it was very culturally different that most people started opting for the Costa Rica option. And once people started going to Costa Rica, this India kind of faded away, and Costa Rica kind of took over that piece of it. We also use Cancun, Mexico. And once that happened, people started traveling more because it was a closer to home. Uh, the language was more familiar, even though it was Spanish. People do speak English very well down there. So patients really gravitated to Costa Rica uh, very nicely, actually, and they just love it. So the way it works, what we did, we offered employees. It was an option. Nobody has to do this. If you're having a procedure, you need a knee replacement, a hip replacement, gastric procedure, whatever. We'll look at it and get a price there in Costa Rica for that procedure. We get that price. If it's lower than what it is here in the U.S., we allow that patient to go and take a companion. So they take somebody with them, and that companion stays with them as the caregiver while they're down there, in addition to the nurses and all that take care of people in the hospital and the hotels. So we do pay for both. And once the patient returns, they get a bonus of 20% of what they saved the company, up to $10,000. So you can imagine that got a lot of people's attention. So in the beginning, I think the monetary portion of the program attracted more people than we had hoped. We'd hoped they'd look for the quality. But as time passed and people came back and told their stories of what procedures they had and how maybe a situation they had here in the U.S. Turned out to be different when they got to Costa Rica or India. For example, we had a fellow here in North Carolina that was set up for a hip replacement. And this is back when most people were going to India. He said, "Well, I'm going to go to India and get my hip replaced over there." We sent him to India, and they're very thorough, India, Costa Rica, and Cancun, about pre-op. And so he got over there, they did the MRIs, they did all the pre-op work, and realized his hip probably was not his problem. So he had a disc issue in his back. They realized that. They did a neurosurgery and lower back surgery and fixed his problem. So he came home and he was better. And he came home and was very grateful. I mean, he was telling people, had I had my hip replaced here in the US like I was scheduled for, I'd still be in pain, and my problem would not be resolved. So when you're dealing with a lot of rural hospitals, sometimes the quality's not where it should be. Even though the U.S. has great health care, not everybody has access to it. This just allows people access to that same great health care at a lower cost at a different destination. The employees have adopted. I mean, we've sent hundreds and hundreds of patients. I mean, I've lost count, but it was an averaging close to 75 a year. We've sent probably 10% of our workforce, when we had 6,000 employees at the time, to a procedure abroad, or probably 15 or 20% of the surgeries in total are accepting this. So our employees have accepted and uh, embraced the situation and embraced the procedures that they can get overseas.
When you talk to your employees about their experience in the hospital overseas getting the procedure and how they feel when they come back stateside, what do you hear from them?
I hear nothing but praise. I mean, these people are very enlightened when they return. They've never had the care that they receive down at these facilities that they get here in the U.S. I'm a prime example. I mean, I've had procedures there myself. I'm a big skier, uh, and I was skiing in Colorado a few years back and ruptured my PCL, which is a tendon in the back of my leg. I went to my local orthopedic surgeon here, who says, eventually you're going to have to get this replaced. You're going to need a knee replacement. These don't repair very easily. We'll do what we can, but not too hopeful that you're going to keep that same knee joint. I've sent the email to my friend in Costa Rica, who happened to be the team doctor for the soccer team in Costa Rica. And this is a very common soccer injury. So he actually replaced that tendon with a tendon from my hamstring. And I was actually skiing in 6 months. So when things like that happen, and these things happen every year, every several months, that people get a procedure they didn't count on that was even better than what they were hoping for. It worked for me. It worked for a lot of people with back procedures. Another example is procedures here for lower back disc issues. In Costa Rica, it's very common to get a disc replacement. Here in the US, they just don't do them because they're so expensive. It's available, but the disc replacement device itself is so very expensive. Back in the day when these were just starting, they were over $300,000 for that procedure here. We were paying 60,000 in Costa Rica for the same procedure. So people were getting better quality procedures than they get locally. Uh, the experience is wonderful. They fly first class with their companion. They arrive in Costa Rica. A patient advocate is there to help pick them up, guide them to their hotel. They check into a nice hotel. Usually they're four-star hotels in the San Jose area or Cancun, if that's where they choose to go. Uh, the surgery happens a day or two after all the post-op or pre-op. At that time, the procedures are done in the hospital. Sometimes we spend the night in the hospital. We try to have English-speaking nurses at those facilities that help guide these patients that don't speak Spanish. Then they return to the hotel where they'll recuperate. So they may be down in the hotel, depending on what procedures they have, for another 10 days, possibly. A nice resort we send them to. They have nice gardens you can walk around. It's a very healing type of environment. Plus, you're at a resort hotel trying to heal. You're not at home trying to make supper for your husband that just got off of work, or your wife that just got off of work, or the kids that need diapers changed. You're there to heal, and you're at a better healing place whenever you return from one of these medical travel procedures, because it's just so in tune to the patient and only the patient. But the experience is wonderful. Again, as many people have never flown that have gone to these facilities. So it's very enlightening to these folks, and it makes them happy employees. We have a very happy workforce, and this is part of the reason.
That's amazing detail. I'm glad you talked about the recovery part of it. I recently had a nanny undergo elective hip replacement in the United States. And then afterwards, she lives in New York City. She had to navigate the subway system in New York City less than a week after coming home to get to physical therapy. And I imagine it's a very different experience, as you know, when patients are recovering in their hotel, physical therapy is coming to them. Um, I'm glad you brought up that example. Uh, you spoke about the cost savings from these procedures. You gave the example of a 300,000 discectomy being 60,000, and opportunities for employees to no longer have copays or even get a bonus from participating in this program. Can you talk a little bit about the employees themselves and how much copays matter to regular people working regular jobs? And I'm not sure our audience necessarily understands how much a $3,000, $5,000, $7,000 copay can matter to somebody.
Yeah, for sure. It matters a lot to folks. As I said earlier, we're a manufacturing facility. We have a lot of hourly employees, but we also have people who have their doctorates as well. But a lot of hourly manufacturing employees who quite honestly live paycheck to paycheck, which is sad, but that's the way the majority of the United States lives. For them to have to pay an additional $3,000 to have a procedure locally, plus be out of work for 6 to 8 weeks on short-term disability, which pays a portion of their salary. It's really not affordable for a lot of people, and we're not coercing people to do this procedures out of the country because of that. It's their options, and that's just an option they have. If they are tight with money and they need the help, they can get that help. But what that does, not only are you saving money on the procedure, as a whole, you have a healthier, working class folks out in the plants that, they don't have to go, let's say you have a knee problem and you just don't want to pay 3,000 out of pocket for that, knee replacement. It could be you're showing up at the emergency room every 3 to 4 months. You're getting pain pills. You get addicted to those pain pills. People avoiding those procedures because they can't afford it do not turn out well. It just doesn't turn out well. Having that option that they don't have to pay those out-of-pocket expenses allows them to get fixed. It prevents those emergency room visits that could be unnecessary otherwise. So healthier employees are happy employees. So not only does it help them physically, it helps them mentally, knowing that they've got this option there for them. In fact, we recruit new employees with this program.
One of the things when we were speaking earlier is that you mentioned some employees have such a good experience that they want to travel again for a procedure at some future point in time. Can you talk to me about how the experience of employees with that first procedure translates on how they think about global centers of excellence and destination medicine go forward?
Sure. The fact that they see their coworkers coming back in such good condition, they know that the healthcare at these facilities is excellent, and they know that. They trust that. They expect it now, and knowing that, they also see their coworkers who didn't do so well locally and realize that, maybe it's not just the money that entices them to go do this. It's the quality of procedures they have. And when you talk to the person who's been there one time and they went again, it's because of the quality, not because of the savings, because they realize uh, how great, it's just a wonderful facility, wonderful doctors, and how great it is. These doctors actually will fly to the United States and come to our locations, usually about every 6 months or so. And when you see these patients that have been there for the first time, especially see their doctor from Costa Rica, they're bringing them cakes, they're dancing the salsa, they're doing all kinds of things to show their appreciation to these doctors who helped them so much and that they didn't have to pay for.
I mean, those are amazing stories. Tim, I think you've told us a lot and given our audience a really fresh perspective on what it's like to receive healthcare procedures at global centers of excellence, what it's like for employees, how employers can think about it as a huge opportunity. And I just want to thank you for your time today.
Happy to do it. I'm happy to help in any way. It's just a great program that I'm happy to talk about.
Thanks, Tim.
Thank you.